Hello, my name's Brenda and I am a registered nurse. I've been with NHS now since 1997. So the announcement that healthcare workers would not be included in the government's public sector pay rise has absolutely slapped our faces with the same hand that clapped us just weeks ago. It has left people feeling undervalued, demoralised, disgusted, disappointed, but most of all, used and abused. Unfortunately, they are also completely unsurprised by all of this. It is abuse of the very people who spend their lives and dedicate themselves and their times to caring for other people's lives. Healthcare workers, some of them in the profession for decades, feel that they're being mistreated by the government. They're in work every day. They change their shifts to cover the service at a moment's notice, no matter what their plans are. They work late, sometimes not getting to see their families. Never complaining because it's their duty to take care of their patients as they come first. Roles have been extended over the years, people taking on more and more duties and responsibilities. Healthcare support workers taking on parts of the nurse's role, nurses taking on roles that were historically a doctor's responsibility. But we just accepted it and got on with it. We feel ignored by the government, who have not acknowledged our worth, have not recognised our hard work, extra efforts and our increased complex skills or dedication. We want to know why we are on average 30% less than some of our colleagues in other public sectors who deserve every penny, but so do we. We are essential workers. What would happen if we decided to take a little break? There would be no one to deal with the sick, no one to deal with emergencies. It's not easy to fill our shoes and do what we do on a daily basis. The government have very cleverly worded their responses to make it look to the public like we have received a lot of pay rises in the past, when in real terms we've had 10 years of austerity, pay freezes, with the 9% over 3 years. It was an illusion. It didn't even bring us in line with inflation. They say some got as much as 27%. This again is an illusion. It took a nurse 7 years to progress to the top of their band. They reduced the time that this took, and it looked like nurses were receiving a huge pay rise, when in reality they were simply bridging a gap in the pay scale band, which again still did not bring the workers in line with inflation. But this allows the numbers to look good. So the generalised feeling is enough is enough. We want to feel valued. We want to be recognised for the work we do and the skills and knowledge that we execute on a daily basis. Trained nurses are a degree only profession with lifelong learning and training. Healthcare support workers, porters, kitchen staff, domestics all do continue courses to keep their knowledge up to date. Our pay nowhere near reflects what we do. We do not want a token rise. They need to stop making a mockery of our profession and end the pay parity which has crippled us for years. We want equal pay in relation to other public sectors. No more taking advantage of our kindness. No other graduate profession is paid as poorly as we are. People are shouting to strike. Just pay us our worth. Especially since the government will always need us, because healthcare never ends.